Hello there, my name is Dorothy Pang, and I am a licensed acupuncturist in South San Francisco, California. And today, our topic of discussion is pediatric laser acupuncture for management of ADHD. Whew, that's a mouthful, huh? Um, I've been doing acupuncture for more than 20 years now, and I'm a parent of three, and I do have a child that's diagnosed with ADHD. So I know how you feel if you're feeling concerned or exhausted or searching something that might help your child, but without side effects, because some of those side effects can be kind of scary, right? Um, so what is pediatric laser acupuncture? So traditionally, we know of acupuncture, which is the insertion of sterilized stainless steel needles through the skin of the body, and they're used to stimulate acupuncture points. I'm gonna have to say that's a hard sell on a kid, and even my own kid I cannot talk into getting acupuncture, which is completely understandable. Hey, there are plenty of grown-ups who don't want to have needles piercing their skin. So I knew that that was never going to work as a treatment option for my child, at least not for many, many years. I wanted something that would help her now, not later. And so there are different ways of actually stimulating acupuncture points, and one of the other ways that we would stimulate acupuncture points, if we didn't want to use needles, is with a laser light. When we use a laser light to stimulate acupuncture points, there is zero pain involved. It doesn't hurt at all. We're not piercing the skin with anything, so it's very safe and non-invasive. We just shine a light on the skin as a way of stimulating the acupuncture point. So the acupuncture point is a way that we can access the body, and we can ask it to do things for us. And so we could do that with the insertion of a stainless steel needle, but we can also do that by shining a laser light on it. So the laser light that I use is not scary to me. I mean, it looks like a pen, right? And it doesn't feel like anything on the skin. When the light's on the skin, it's not even warm. So let me just demonstrate on my baby doll here. So here's a baby doll. So if we were to do a session for a kiddo in the office, first we do paperwork and we do the survey to see, to compare progress for later, what kind of symptoms are happening right now and the severity of them, right? And then after you fill the symptoms sheet, you and your kid can come into the treatment room, or if you are comfortable enough and the kid is old enough, the kid can come in by themselves. And if they're younger, you could come in with them, they can sit in your lap. So first I would locate the acupuncture point. I typically feel around a little bit, and then all I would do, let's make sure the camera's catching this, is shine the laser light on the acupuncture point. The point stimulation time is about 10 to 30 seconds. So if the kid is very young, it's close to 10 seconds. If the kid is closer to 18, then it's closer to 30 seconds. It's not that long. And yes, kids might wiggle. That's okay. I can work with that, right? We're just, I just have to keep the light on the point for 30 seconds. We can work with that. Once the point is done being stimulated after 30 seconds max, I feel around and look for the next one, and then we stimulate that point for 10 to 30 seconds. Overall, we use about a dozen points total, and the actual active treatment time is maybe 6 minutes if the kid is super cooperative, and maybe 10 minutes if the kid is feeling wiggly. Totally doable, right? Because I know that as a parent of a child with ADHD, that sitting still may not be their forte, and they're not going to be super into that. So that's okay. We work with it. It's totally fine. And the great thing about using a laser light to stimulate acupuncture points is there's no side effects because the skin stays intact. There's nothing going into the body except for light. That's a debatable thing. And so the literature shows, the research shows, literally zero side effects. So that makes it a great treatment option. Studies have shown that laser pediatric acupuncture for ADHD helps to regulate the nervous system, improves focus, and improves sleep, and really balances out and helps with emotional regulation. And again, it's super safe. The laser is FDA cleared for use on the surface of the skin. There is no pain involved. The treatment itself is very short. So it's very tolerable, the whole treatment process for the child. So most kids think the laser is kind of cool. They're not scared of it because, again, it doesn't feel like anything at all. And the treatment itself is relatively short. You could be done in 10 minutes. If you have any questions about pediatric laser acupuncture for management of ADHD, please contact me. I do offer free consultations. If you'd like to book one, I'll put the link in the description below. And if you are wondering what your treatment options are and you're a parent and you're confused, I've been there, and I've personally seen, for me, that the treatment options were not great, and I didn't love any of the ones that were available. So maybe consider pediatric laser acupuncture if you're hoping to help your child, but you don't love the thought of medication, and don't think that they'll respond or be into therapy. Also, if you have a child that's already on medication, you can still combine that with the laser acupuncture. That is absolutely okay. I would just recommend that the medication dose be stable throughout the pediatric laser acupuncture process, so that if there are change in symptoms, and there should be, we know what's causing the benefit. So you can offer both as a combined treatment to your child as well. Don't think, oh, I'm taking meds, like I can't do this. Totally, we can combine them and maybe get your child feeling even better about themselves. Once again, my name is Dorothy Pang. Please contact me for consultation. If you have any questions, I would love to answer them. You don't have to do this alone. All right. Hopefully I'll be talking to you soon. Take care for now. Bye.